Welcome to this episode of Ask Dr. Reg. It's Dr. Regina Nelson with Ask Dr. Reg. Thanks for tuning in. I hope you like and subscribe to the YouTube channel. I'm starting to answer questions that have been submitted to me. One of them from Amy was, how has cannabis education changed in the last 10 years? And I've been in cannabis education for just a little over 10 years. And it's changed tremendously. When I first started trying to convince people that we needed education out here for patients, for employees, for business owners, it seemed like a very novel idea, and there were not very many people in it. So I've been trying to empower people around that because I feel like there's a ton of space. There's not even room for competition yet because there are not enough people out here educating about cannabis, the use of cannabis, the processing of cannabis, the licensing of cannabis, all sorts of stuff. And because of this gap in education, we see problems in all sorts of things. So how has it gotten? Is it better? Yeah, it's a lot better than it is. I'm really excited. Oklahoma just put into new regulation even that they're going to require CME for physicians in the state, at least starting with those that are recommending, and I hope it goes to all physicians, that they have to have some education around the endocannabinoid system and the use of cannabis. It's why I created the condition certification program. However, I've provided that education, which is CME accredited by the American Academy of Family Physicians and the American Veterinary Association for our pet section in level 2. Beyond that, I made it for doctors and put it out there, and primarily my audience has been nurses from a healthcare perspective, but much more so industry professionals who really have a heart for helping patients, and patients themselves who often come in and get in the industry after they start seeing improvement in their own health. So all of that said, it's definitely improved. If we could ever get past the Schedule 1 status, what I'd like to see is that these companies that have monopolies in multiple states really invest in getting education out there, because I think their customer base is limited by who knows and understands how good cannabis is for the body. So I hold a lot of hope for the future. I've been on a long, hard journey in the cannabis industry. I don't feel like education is valued as much as it should be, but I do see improvements in a lot of ways. A lot of states bringing education through employee credentialing and other ways. But is it good education? Is it education that's going to be meaningful? I hope to be more involved in things like that in the future, and I hope you are too. So stay tuned. Hey ladies, it's Dr. Regina Nelson reminding you, check out Higher Hopes, Women in Leadership, now on Learn Worlds.